All right, so this is a bisected pelvis. So to orient you, we're looking at it from the anterior surface. This is like the anterior abdominal wall. This is the anterior thigh muscles and the medial thigh muscles. We've got our testis and our spermatic cord down here already dissected out. We've got the penis here. So I'm gonna just walk you through these various structures. So here again, and this is the skin of the anterior abdominal wall. So if we reflect that, we'll see our abdominal oblique muscles. So this is the, well, mostly the fascia surrounding it, but also the external oblique muscle. And so you can see we've cut that here to reflect, and now you can see the muscle fibers a little bit better. Then under that, or deep to that, going the opposite direction, we've got our internal oblique muscle with our internal oblique aponeurosis coming off here. Reflect that, we've got our transverse abdominis here. Same thing with the aponeurosis coming off here. And I kept these so you can really see what is traveling down with the testicle, and also so that you can really appreciate the layers of the abdominal wall. So here we've got the external oblique aponeurosis, the internal oblique aponeurosis, and then we've got our transverse abdominis aponeurosis kind of splitting here. So we've got fibers here, we've got our rectus abdominis, and then we've got our transversalis fascia here. So, okay, so we've got here, if we put the abdominal aorta back into place, we've got abdominal aorta, we've got common iliac splitting into external and internal. Then we've got your inferior mesenteric artery. So these would be the sigmoidal branches going to the sigmoid. This here would be your left colic, and then this would be that marginal, and you can still see the anastomosis where this would be connecting with the branch coming from the superior mesenteric artery. So this would be the level of like your splenic flexure. You can see the transverse mesocolon here. So after that, remember you have your superior rectal artery. So the superior rectal artery is actually right here. It's just still kind of in this mesentery right here. So we can follow that a little bit farther, but it's gonna go to the top of the rectum. Okay, so that's why I kept those so you could see those, but I did cut it and kind of reflect it out of the way so we can really focus on the pelvic structures. So inside the pelvis here, some of the main things that you should be able to recognize are the different arteries and definitely the different organs. So this is a male, obviously, and so we're gonna walk through these. So before we do that, let's just kind of get this out of the way. So this would be your common iliac vein with your external and then your internal. I cut most of the internal off so that you could see the branches of the artery, because those are a little bit more important for our purposes right now. So now we have a clear view. All right, so we've got our bladder here, and then we've got this structure kind of coming back from back here. So what do you think this is gonna be? It's coming, if you follow it, look, it's going into the spermatic cord. So that's actually your vas deferens. So let's pause and go over our spermatic cord. So here, obviously this is already dissected, so you can see the different layers of the fascia here, which I kept so that you can understand those and their connections to the obliques. But then if you look closely in the external part, you can see like little strands of muscle fibers. Those are the strands of the cremaster muscle right there, okay? And then you can see all these little veins. Those are gonna be your piriformis plexus. And then this is that structure that we were just seeing, which is your vas deferens. So here, remember the vas deferens is gonna be coming from the end of the epididymis. So this is the outside of our testis. We've got our epididymis here. So if we open that, we can now see the testis. So this is the testicular parenchyma with your seminiferous tubules. So if we actually pull on that, you'll be able to see seminiferous tubules coming out. See? So all those little string things. See those guys? Those are your seminiferous tubules, okay? And then here, this would be the tunica albuginea, pretty thick, white. And then this would be that tunica vaginalis. So this like thin layer here is that tunica vaginalis, separate from the overlying fascia, right? So I kept that kind of separate but together on purpose so you could really see the difference between those. So fascia, the different layers of the fascia, this would be your tunica vaginalis, this would be your tunica albuginea. And then remember, the sperm, after they're made, are going to come and leave the testicle through those smaller ducts, which is hard to see those grossly, and eventually they'll get to the head of the epididymis. So that's what this is here. This is the head of the epididymis. So if I'm holding just the testicle kind of back in place, this would be the head of the epididymis, the body, and the tail. So here you can clearly see it coming off. So this would be the edge of the testicle, head of the epididymis, body, tail, and then it's gonna go through the vas deferens, up through the cord into the pelvic area. So other things in here, I guess basically just see all of these little veins. Those would be piriformis plexus, and then the artery is actually this one right here. So that's your testicular artery, and then the nerves in here. This looks like that genital branch of the genitofemoral nerve. And that's pretty much the highlights of that. Okay, so let's get back inside the pelvis. So we just identified this as our Vas Deferens, right? So here we've got the Vas Deferens, okay? So remember that the Vas Deferens comes up from the epididymis. It's gonna travel in through the spermatic cord, up through the inguinal canal, and then come back into the lower abdomen and pelvis, and then it's gonna come to the prostate gland. So this is actually your prostate gland opened up here. So this is bladder, all of that is bladder, and then from here to here, that's prostate. So I know it probably all looks really tan right now because it's super fixed, but this is like the prostate opened up. So this would be, I cut right through that urethra. So right where the probe is right there, that's your urethra. So this would be like the left anterior lobe, the left posterior lobe, and notice that this hole, if I close it back up, well, I don't know if you can see this on the camera, but you can see the urethral orifice here. So this would be that internal urethral orifice going into the spongy urethra. What am I saying? Not the spongy urethra, the prostatic urethra here through the prostate, and then that's gonna come out, and we'll go through the penis in a second, but that's what this is. So if we look at the back of the prostate, so all of this is prostate. If we close it back up and look at the back of it, this is that Vas Deferens. And remember, the Vas Deferens is just medial to the seminal vesicle. So this is the seminal vesicle. This is the Vas Deferens, and then we can follow and confirm that. So again, yes, Vas Deferens. Okay, so we've got Vas Deferens, seminal vesicle, prostate, bladder. You also have the ureter here. So that's the cut surface, that's the lumen of the ureter. And then it's gonna open up in the internal portion of the bladder at that ureteral orifice at the top of the trigone. So that's honestly kind of hard to appreciate on a very fixed bladder like this, but it's gonna be opening up right about here. So you'd have ureteral orifice, you'd have another ureteral orifice on this side, and then in the middle, you've got that internal urethral orifice. So this is ureter, okay? And then remember, those have a specific relationship. So notice that the Vas Deferens is kind of coming right here, and then your ureter is right next to it. So those kind of like cross over each other right about there, okay? Other organs in this area, so we've got rectum. So we did up to the sigmoid. So if we put this back in its location here, this rectum was very full. So this one is very, very dilated in this case. It's not usually going to be this wide on opening, but here this would be rectum. And then if we open it up, you can see that junction where the mucosa starts to change here. So this would be anus, and then this would be the end of the rectum, and then the beginning of the anus right there. So we can try to kind of clean that up a little bit to see if we can see a nice dentate line, but this would be like distal rectum, this would be anus here, so this is like skin flap right here. And if we cut through here, we might be able to appreciate the anal sphincters, but sometimes you can't really see it because it all kind of blends together. So rectum, anus. So if we get this kind of pulled back out of the way, now we're gonna go over the main arteries. So that was like the bulk of the organs, right? We haven't done the penis yet, but we'll come back to that. So if we kind of pull our bladder out of the way here, what we're gonna see, we wanna really look at these branches of the internal iliac. So here we had the common iliac splitting into internal iliac, and then this is external iliac. So we've got that out of the way. So what you want to look for when you're looking for these, your reference structures are really going to be the nerve structures. So I've isolated those and kind of put this probe under it so you can hopefully appreciate it in the video. I know it's probably hard to see on the camera, but you are going to see this in lab too. So here we've got our probe under all of these nerve structures. So if we put this back down and look, here was our Psoas Major. So I've kind of pulled that apart so you can see the beginnings of that lumbar plexus. So this is actually the obturator nerve. Remember, that's the only one that's coming off medial to that psoas. So here would be your psoas. This would be the obturator nerve. And if you look up here, you can actually see it coming from its various portions. You can also see, if you pull the psoas this way, you can see the femoral nerve forming from its ventral rami here. So this would be the femoral nerve, right? As we learned it with its relation to the Psoas Major, and then you can actually see its ventral rami forming to form it there. So if we can get this back out of the way. In here, you can now see the rest of those ventral rami. Now we're gonna shift our focus to the sacral plexus. So in here, in the sacral plexus, you're gonna have that lumbosacral trunk coming in, and then you'll have S1, S2, S3, and S4. So what those look like is, this is that lumbosacral trunk because it's coming partially from the lumbar area. So it's gonna be basically a portion of L5, a tiny portion of L4, joining with S1 down here. So this is the portion coming above. So it's gonna be above the level of the sacral promontory, which is here. So here's your sacral promontory. That is gonna be your lumbosacral trunk, okay? So it's coming here behind these arteries, and then it's going to join with S1 right there. So S1 is here. This is coming out the level of that first ventral sacral foramina. So this would be S1, S2. So these, if I put a pin here, you would tag this, or you would write your tag as ventral ramus of S1. So this would be lumbosacral trunk, ventral ramus of S1, ventral ramus of S2, S3, and S4. Look how small S4 is. It's this little tiny guy right here. But the reason I make you learn these, it's not necessarily that I want you to know like which ventral ramus each little branch of the sacral plexus is coming from. That's not the point. It's just that these are very helpful with figuring out which arteries are which, okay? So this is gonna be your superior gluteal artery, which is diving in between your lumbosacral trunk and your S1. And then your inferior gluteal artery here, typically, this is actually kind of odd, typically it's gonna dive right up here in between either S1 and S2 or S2 and S3. In this case, it's actually diving a little bit farther down, but this is gonna be that inferior gluteal artery, okay? So it's gonna be going, in this case, a little bit beneath your S2 and S3 here, okay? So that's why you learn these are helpful reference structures. So now I want you to notice what these are sitting on. So all of these are sitting on muscle, right? Like, you know what muscle looks like. This is all your muscle in here. So remember that that's actually your piriformis muscle. So piriformis is starting in here. It's gonna go through that greater sciatic foramen with all of these nerves to form, these nerves are forming your sciatic. So the piriformis is going right through there, and then it's gonna come out the greater sciatic foramen, and that's where you learned it in the gluteal region from the back, okay? So let's start at the beginning. So we have internal iliac here. Remember, your internal iliac is gonna split into basically two trunks. So your anterior trunk is gonna have a lot of branches, and your posterior trunk is typically only gonna have 3 little branches. So posterior is easier. So this whole chunk here is like that posterior trunk, and you're gonna have 3 branches coming off. So the first one is gonna go basically straight up. So this is that first branch, which is your Ilio Lumbar branch. So here it's coming off, it's going straight upwards towards the iliac region and the lumbar region. So this would be Ilio Lumbar artery. Then you have those lateral sacral arteries. So sometimes you'll see like one nice one coming off and giving off a branch that goes in each foramen. Sometimes you'll see a couple small ones coming off. In this case, we have a couple small-ish ones coming off. So this would be a lateral sacral artery because it's gonna dive right into that sacral foramen. Same thing here, this is another one. So both of these would be lateral sacral arteries. And then the third branch of that posterior trunk would be this, which is that superior gluteal artery. Notice how big it is. There we go. That is superior gluteal. So notice how big it is. Again, it's going in between the lumbosacral trunk and S1 to get to the gluteal region. And this is why when you see it in the gluteal region, it's coming out superior to that piriformis muscle, because it's gonna dive out up here, and piriformis is kind of tapering off, okay? So that's the posterior part. And then the anterior part has a bunch of different branches. So these are the ones that start to get a little bit variable, but again, you can always tell what they are by where they're going. So that first branch you want to look for is going to be that umbilical artery, which again, in the beginning, it is patent because it's giving off a couple small branches, but then it's going to kind of obliterate as the median umbilical ligament. So that's this here. So this would be the anterior trunk of the internal iliac. All of this would be umbilical artery. And then you can see all of these little branches coming off of it. Like, I need like 6 hands to do this. But all of these little branches, like here, 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 those are all superior vesicle branches because they're going to the top of the bladder. So remember, this is the bladder that I'm kind of like holding out of the way. So all of this would be umbilical. So I could tag it here, I could tag it out here. It would be umbilical artery all the way along there. And then all of these little branches of it would be superior vesicle. Now, if you look at the very end of it where it tapers off, you can actually see where it turns into the median umbilical ligament. So watch it traveling through here. So here it is, it's traveling through here, and I left this intact like this on purpose because that's actually the cut surface of it, and notice that there's no lumen. So right about here to here, when you're feeling it in lab, you can feel it's kind of like tapered off, it's kind of fibrosed over. So at this point, if I tag it over here, this is no longer the umbilical artery, this is actually the median umbilical ligament. So be careful with that. So umbilical, superior vesicles, then you also have an inferior vesicle coming off of internal iliac, and that's going to go to the bottom part of the bladder. So that's what this is. So it's coming off, it's going to go to the bottom part of the bladder. So it's kind of coming in here to the inferior portion of the bladder. Then you're going to have, well, normally you would have an obturator artery coming off, but this one is actually really cool. This is an anatomic variation that happens sometimes. I've seen maybe a handful of these, and by handful I mean like 3 probably total. So normally you'd have an obturator artery coming off right here, and then it would travel this way and meet up with this, which is your obturator nerve, and go through the little hole there. That's your obturator canal. So remember, on the bone you have a big obturator foramen, but in real life a lot of it is covered by the obturator membrane, and so you just have a little canal here. So this is that obturator canal. So this is definitely that obturator nerve. So normally you'd have a little artery coming off here and traveling in there, and that would be the obturator artery. In this case, it's actually coming off of external iliac, which is an anatomic variation, but it's not that uncommon. So I could still tag this as obturator because, again, the thing with the pelvis arteries is they are pretty variable, so you want to always look at where they're going, not necessarily where they're coming from. So this would still be a fair tag because you can see it meeting up with the obturator nerve and the vein, which I cut here because it was in the way. I cut out pretty much all the veins. But you can still see it meeting up with those and going through the obturator canal. So this would be obturator artery, obturator nerve. So normally, you know, according to like the book, the classic thing, it would be coming off of here. And then moving on, again, we had that inferior vesicle going to the inferior portion of the bladder. Then you're gonna have this coming off. You have a couple more. You had a middle rectal here, which I actually broke when I was trying to get out this rectum because this rectum was so dilated and full of fecal matter. So unfortunately I ripped that one, but it would normally be coming off of here and going to the rectum, and that would be your middle rectal. But then these last two here, you've got this pretty big one that's typically, again, we said it typically goes right here, but you can still see it's kind of going in between S2 and S3. So this would be that inferior gluteal artery. And then this last one, this is an internal pudendal artery. And you know that because it's diving right into that greater sciatic foramen. So it's going out the greater sciatic foramen, and then it will come back in to get to the perineal area after it wraps around this ligament right here. So it's gonna be smaller than your inferior gluteal, and it's gonna be right against that ligament here, whereas the inferior gluteal is typically more close to these nerves up here. So that's pretty much all of the branches. So to recap, we had the internal iliac splits into its like anterior portion, posterior portion. On the posterior portion, you have 3 branches. You have the Ilio Lumbar, which basically comes right off and goes straight up. You have lateral sacral. So this one, we have a couple little branches because those are diving into the sacral foramen. And then you have that superior gluteal. That typically goes right in between that lumbosacral trunk and S1, the ventral ramus of S1. Then on the anterior portion, you'll have the umbilical artery coming off. It gives off all those little branches, which are your superior vesicle. You'll have an inferior vesicle coming off and going to the inferior portion of the bladder. You'd normally have an obturator coming off, but this is variation here. You'd have a middle rectal coming to the rectum. Then you'd have your inferior gluteal and your internal pudendal. Okay, so you do have to know the different portions of the nerve and all of those branches of the arteries. We went over the bladder, we went over the ureter and the vas deferens, we went over the obturator nerve, went over this stuff, we went over the spermatic cord. So I think all that's really left is the penis. And this one, on the outside, this entire portion is the head, so the glans penis. So if I put a pin like out here, that would be the glans penis. And then see this like thickened area at the proximal portion of the glans? This is the corona, or the crown. And then actually right where I bisected, this just happened to be also right in between the vessels. So this is actually the lumen of the vessel here, which kind of screws that up for tagging, but meh. And then here you would have your corpus spongiosum here, And then this would be the corpus cavernosum here. Now this is not the best example of this, so I'm gonna try and see if we can get a better one on a removed one or on the other half of this, but that's pretty much it for tag purposes. All right, so this is a female bisected, and so on here, just to kind of give you some general orientation, we've got anterior abdominal wall with our rectus abdominis and our rectus sheath still intact. You can see the inferior epigastric vessels. You can see the external, internal, and transverse muscles, and then you can see from a side view, this would be bladder, pubic symphysis here, bladder, and then right behind the bladder right here, this is gonna be the fundus of the uterus right here. And if you look at it, hopefully you can see, this is the fundus, the body, the lower uterine segment, and then cervix. So this is a very small uterus because this was an elderly woman. You can also see inside the vaginal canal here. So all of this is vaginal mucosa, and then that is cervix. I don't know if you can really appreciate this in the video, but that is cervix protruding into the vaginal canal, and you can see the external cervical opening, that cervical os right there. So we've got bladder, uterus, and then remember just behind the uterus, this would be rectum here. So this is rectum. So here we have that vesicouterine pouch, not very big, and then you can see why that peritoneal reflection would be broad. And then back here, I mean, I've separated these to do the dissection, but this would be that rectouterine pouch, or that pouch of Douglas in here. So then looking in here, what other structures can you see? So this would be like what's left of that broad ligament, but it's dissected so that you can see the different structures. So here, this would be fallopian tube. So here you've got some peritubal cysts, which we'll talk about in path. We have some little fimbriated end here, that's the edge. And then remember, the fimbriated end is gonna sit right by the ovary. So these would sit like this. And then that is the ovary. Again, it's small because this woman was elderly, and so she stopped producing her hormones, you know, after menopause, and so the ovaries typically shrink after that. So here, this would be ovary, fallopian tube, fimbriae. Those are some little peritubal cysts. So all of this would be fallopian tube. So we've got the 4 different parts of that. And then this is part of that broad ligament surrounding that tube. So this would be the mesosalpinx, the mesometrium, and then the mesovarium here at like surrounding the hilum. So like this area right here. This part kind of coming off of here, this is actually the ovarian artery and vein. So remember, those were up in the abdomen, and you can see them going right to the ovary right here, meaning that this would be that ligament. Here you can see the ovarian ligament. And then the other thing that you can see, which is pretty cool, remember the round ligament of the uterus? It's similar to the vas deferens in the male. So here, the round ligament is going to be a remnant of that gubernaculum. So it's going to be here inside that broad ligament. You can kind of feel the difference here, but then you can actually see it coming out. It's a little bit cut right here, so be careful when you're looking at it in lab. But here, this would be that round ligament, and remember, that would come out through that inguinal ligament to attach to the labia. So here, we've got broad ligament, round ligament, fallopian tube, and then ovary, and we've got our ovarian artery and vein here. Okay, so flip those out of the way. Now we've got all of the different vessels in here. So this, just for reference, is your ureter coming down. So that would be entering, you know, here at the trigone. Now our vessels. So we've got our common iliac artery here. This would be external iliac, which is going to turn into femoral. This would be that internal iliac. And then the branches of internal iliac, we've got that first one, which is that obliterated umbilical artery. So proximally, it's still patent. This would be umbilical artery. There we go. All right, so all of this would be umbilical artery, and you can see all of these little arteries coming off of it. There. Those would be your superior vesicle arteries, because those are going to the bladder here. So umbilical artery, and if you follow it within that peritoneum, this is actually, so umbilical artery, and if you follow it here, you can follow it all the way here to, see? So we're following it, and so out here would be obliterated. So this out here would be the median umbilical ligament, and over here it would be the umbilical artery. And so if we hold it out, you can see all of those little branches coming off of it would be the superior vesicle branches. And then out here, after it's obliterated, this would just be the median umbilical ligament, okay? Okay, so in here we've got that superior vesicle arteries are all gonna come off that umbilical. So this is your umbilical artery. It's gonna obliterate out here. So this would be the obliterated umbilical artery, which is also known as the median umbilical ligament. And then all of these little branches coming off of it before it obliterates, those are all your superior vesicles. So even these, like, these last couple probably are still some vesicle, because it's still coming to the bladder over here. Versus this one, this looks like it's gonna be uterine, because it's coming right to the uterus. And if you look at its relationship with the ureter, that's the key here. So this would be uterine artery with your ureter, and then these guys would be more of those little vesicle branches. And then this, I'm not really quite sure what this is. This is probably vaginal branch. And then here we've got internal pudendal and inferior gluteal. So yeah, I would go with uterine, maybe some inferior vesicle, maybe some more inferior vesicle, or maybe vaginal. But I would say, okay, so definitively the ones that I will be fair to test you on would be umbilical with your, get out of here, with all of these little superior vesicle branches. And then this one, I'm gonna go ahead and call this more superior vesicle, but I'm not gonna test you on this one. And then this one I would definitively call uterine, crossing over with ureter here. And then this one, I'm gonna go with vaginal, but I won't test you on this one just to be fair. And then these are fair game. So internal pudendal, inferior gluteal, superior gluteal, lateral sacral, ilio lumbar, posterior trunk, anterior trunk. Cool. I know that there's a lot of branches in here. Just do your best with them. I'll be fair for the tags. So other than that, I think that's kind of it for female, I think. I'm trying to see. Yeah, I think that's kind of it. Ooh. Never mind. What about our obturator? So on this one, we have another one of those anatomic variations, that obturator coming off the external iliac. Interesting. It's interesting that we have two of those.